Yes, ma'am. I will be sending you the link. Just give me 2 minutes, and after that, I will. Good evening to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Sania Hasnan. Ma'am is MBBS MD Hospital Administration Technical Product Manager, Salaso. With the help of ma'am and her wonderful insight, we will be taking a close look on today's topic, which is clinical decision support system. Now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her. Over to you, ma'am.
Just share my screen and yeah. Hi, everybody. Good evening, and thank you for joining me today. I'm Dr. Sania Shehbaz Hasnan. I'm a physician with about 10 years experience in healthcare. I've worked with various hospitals in India and various health tech startups in India and in London. I'm currently based in the UK and have been working with clinical and engineering teams to build digital solutions for doctors and care providers and patients. As a doctor in digital health, I want to bring the knowledge about AI and the latest technology to doctors across the globe. The landscape of healthcare will be more digitized, and AI will become a colleague, bringing useful insights into patient care. As doctors, we must embrace the change while at the same time being cautious of new advancements that come with their share of policies, ethical, and legal issues. In today's session, I will speak about the advances that AI has brought in healthcare. We will delve deeper into clinical decision support systems, and we'll also talk about some benefits and pitfalls of using technology, and what we can do as doctors to prepare and to be careful in such a dynamic environment. Let's take a look at what are some of the used technology tools and artificial intelligence in diagnostics. We have medical image interpretation, your X-rays, MRIs, ultrasounds, and so on, with a lot of data and algorithms is interpreted, and a result is given to doctors. Pathology and histology analysis, automated electrocardiogram analysis. AI is being used in dermatology for skin analysis, endoscopy, colonoscopy, AI in neuroimaging. Diagnostic chatbots are available, and early detection of diseases like Alzheimer's, Parkinson's, various other diseases. And of course, there's one area that we have been seeing for a while, that's workflow optimization. Then there is artificial intelligence in treatment. A lot of you would have heard of precision medicine, drug discovery and development, robotic surgery assistance, smart prosthetics use. Remote patient monitoring is something that a lot of us have been seeing. Automated insulin therapy. So if a diabetic patient has blood glucose level that's fluctuating, insulin gets delivered automatically within the body to ensure that we have a stable blood glucose level. Clinical decision support system. Now, this is then in the area that we will be discussing more about. This is the area that we will be discussing more about, on how this is being used in different areas in hospitals, and what are the different features that are available. And of course, AI technology, you've heard of your Fitbit, Apple Watch, and various other devices, not just those that are worn, but devices that can be kept close to your bed, on your office table, and so on, which detects an exacerbation of asthma, or a cardiac event, potential cardiac event on that could be oncoming, and so on. Let's take a look at clinical decision support system. I'll be using the abbreviation CDS or CDSS during this session. Clinical decision support systems are digital tools that can support clinicians to make evidence-based decisions. They give the right information to the right person in the right format through the right channel at the right time. CDSs have shown to enhance the quality of decision-making and reduce errors along with unwarranted variations. Now, many clinical staff are already using this in their routine clinical practice as clinical calculators, alerts, automated order sets, or links to reference and educational material within electronic medical records. Let's take a look at some of the existing CDSs around different hospitals and trusts. I'll take a few examples of this being used in the UK, followed by some examples of how this is being used in India, and so on. So here's an example of these are existing systems being used. They are already implemented in different hospitals. My intention is to bring awareness of the various systems and the capability and how it's benefiting clinicians. And as clinicians, it's important that we are aware, we know, and we're able to leverage technology, for better patient outcome. One of the things that we can see is recognizing deteriorating patients. Now, CDS was used by Cambridge University to generate an electronic alert when a patient's clinical observations met the sepsis criteria. A series of electronic prompts within the electronic record guided the clinicians through the actions and tests needed to diagnose sepsis. Within the system, clinicians then selected the order and the most appropriate antibiotic to treat the source of infection, with the system recommending the correct dose and frequency in accordance with the patient's clinical status and inbuilt national guidelines. Taking another example of a neonatal electronic patient record for pediatric ICU. A bespoke electronic record was developed for use in pediatric intensive care unit with inbuilt capabilities for clinical decision support. This alerts the staff to important patient information, including allergies, escalation plans, and safeguarding, and important clinical issues such as infection control and difficult intubation. Here's another example of how a CDS helps fluid balance and sepsis screening. After introducing an electronic record with functionality to capture clinical information, North-Tees introduced additional modules to capture clinical observations. This included fluid balance and sepsis screening tools. After input of observations, a visual rule flags whether a patient is at low, medium, or high risk of clinical deterioration, prompting clinicians to escalate the case if necessary. When a clinician completes a screening tool, the visual rule appears and prompts escalation, and the treatment will start. Another example is implementing an EPMA, Electronic Prescribing and Medicine Administration System. Gateshead, for instance, implemented an EPMA, again, Electronic Prescribing and Medicine Administration System with inbuilt CDS capabilities to facilitate safer prescribing, more efficient workflows, and better use of data for auditing. Various alerts, such as allergies, have made prescribing safer and fewer adverse outcomes. The system also supports decision-making around prescribing the most cost-effective medicine, reducing the annual cost by £72,000. That's around 77 lakh rupees. That's just an example of the benefit that these systems bring in with respect to cost other than patient care. Another interesting use of a clinical decision support system being used today is improving blood transfusion. An end-to-end electronic transfusion process was implemented to reduce the risk of wrong blood being transfused and the important use of blood. It uses barcoded patient wristbands and electronically controlled blood fridges, and this is integrated with electronic patient record and the laboratory system. The users are guided to complete certain processes to ensure safety and process completion. For instance, checking identification wristbands and printing labels. The electronic process has greatly improved the safety and obviously the efficacy of transfusion and has been able to reduce cost by 1.2 million over the last 4 years. Another example is a management and supervision tool that the doctors are using in one of the trusts. Mercy Care Trust, for instance, developed a management and supervision tool that uses artificial intelligence-powered algorithms to analyze mental health data from multiple sources. Now, this helps them determine the likelihood of patients accessing crisis services within the next 28 days. The insight supports decision-making, obviously based on patients' need, and guides appropriate allocation of patients to safe and effective care. This is an example of how AI, is being used, looking at multiple sources, gathering a lot of data, and be able to give accurate information to clinicians beforehand to predict which patient would need a mental health, care, and be able to help them well in advance, obviously improving clinical outcomes. Another interesting use of CDS, clinical decision support, is pharmacogenomics. Pharmacogenomics is the study of how an individual's genetic makeup influences their response to drugs. Pharmacogenomics-based prescribing can improve the efficacy and effectiveness of medication and reduce potential harm from adverse drug events. This obviously requires in-context alerts integrated into existing prescribing flows. This is something that the NHS is working on at the moment. So these were some examples of existing CDS systems across mental health, blood transfusion, drug delivery, decision-making, day-to-day treatment, and so on, that exists in the UK, of course. I've taken an example from here. But if you look at the overall world landscape, there are many countries, devising a lot of different CDS. India, we will look at the CDS systems that are available in India, and there's a lot of interesting work. There's a lot of different tools, amazing tools that are available for doctors that would help with, improved patient outcome. Now, let's take an example of one clinical scenario here to see how a clinical decision support system can help a doctor through one single case, step by step, from history taking to initial diagnosis, differential diagnosis, followed by investigations, and then the entire treatment and management, surgery if needed, and medication management, and so on. So let's take an example of, I have a patient by the name Anna, who's a lady who's 52 years old. She came with abdominal pain in the upper quadrant, which she said worsened over the last 24 hours. Anna says that the pain was sharp in nature, it was constant, and it radiated to her back. The pain was associated with nausea and 2 episodes of vomiting. She said there was no history of trauma, and she had some fever. I've taken a very simple, very obvious case. The intention is not to case and split it, but to explain to you how a CDS system helps doctors in their entire workflow. So let's look at the first area, diagnostic assistance. A CDSS can help doctors by providing instant diagnostic suggestions based on patient's symptom, history, and test results. Now, in Anna's case, the CDSS can quickly recognize the constellation of symptoms of acute cholecystitis as a probable diagnosis, along with giving the clinicians a list of all the differential diagnoses. Now, this is information that a lot of us know, but a lot of us, it's always nice to have that support available, that you have a list of all your differential diagnoses, you have your probable diagnosis. Let's look at what we do next. What is it that the CDSS will give you next? It can recommend appropriate diagnostic tests as well, imaging studies to confirm or rule out the probable diagnosis. The system may suggest an abdominal ultrasound, for instance, and a battery of other tests, aiding the physician in confirming the gallbladder inflammation in case of Anna and identifying any potential complications. CDSS can also help with treatment recommendation. They provide evidence-based treatment guidelines. So, these systems come with a lot of recommendation. All your medical literature would be available, the latest, articles published across the best of journals. There's data of thousands and hundreds and thousands of patients in the past with that particular illness, a variety of treatment available, etc. All of that information, something that we acquire over years of learning. Some of us, let's say, very early in our career, do not have that level of information, but a system comes with, thousands and thousands of literature, books, patient data, and obviously will be able to, give you the right kind of support to make the right clinical decision. Looking at the application here, the system can recommend specific antibiotics for the management of cholecystitis for ANA and guide the physician on pain management strategies tailored to the patient's condition. What else can it do? Risk assessment and alerts. Now, CDSS can access the patient's risk factors because it has a lot of past data of the patient and provide alerts for potential complication. In Anna's case, the system could flag the elevated white blood cells, for instance, and maybe an abnormal liver function test, alerting the physician that there's a possibility of complication like, gangrenous cholecystitis. Right? This is just an example of what else CDSS can provide the clinician. It can also help you with clinical surgical decision support. Now, CDSS can assist in deciding the optimal timing of the clinical intervention and also provide guidelines on post-operative care. Once ANA's acute symptoms are controlled, the CDSS could suggest the appropriate timing for laparoscopic cholecystectomy and provide insights into potential benefits and risk. This obviously can be integrated with the existing medical record. My understanding is a lot of us, in fact, most of us are using electronic medical records, whether it's in your private clinic or whether it's in the different hospitals that we're working in. CDSS, they integrate with EMRs and can access patients' medical history. Now, how does that help? The CDSS having access to Anna's medical history can take into account her occasional indigestion, for instance, aiding in a more comprehensive and a personalized approach, something that we may not know, or we may not be able to pull out instantly, but the system will be able to tell you, hey, these are a couple of other things that we need to take into account. Here's a more personalized approach for this particular patient, and not just a standard treatment given to everybody anymore. A very important area, where CDSS is being used very commonly and obviously supports is preventing medical errors. Now, in Anna's case, the CDSS can, for instance, flag potential issues with her medication, ensuring that the prescribed antibiotics and pain management drugs are appropriate for her condition, taking into account any allergies or any contraindication, any drug-drug interaction. This feature enhances patient safety and obviously contributes to the overall quality of care. And lastly, something that's, again, very important, involving the patient in their own care, engaging the patient. CDSS can generate patient-friendly education material to enhance patient understanding and compliance. This could be in the language of the patient, and in simple terms, so that, and with, infographics, etc., making it interesting for patients to read and get educated about their condition. The system, for instance, can provide Anna with information about cholecystitis, its management, and the importance of proposed interventions, fostering obviously a shared decision-making and improving patient engagement. Let's take a quick look, of what a CDSS really looks like. So here, this is just one example. For instance, a CDS here, at the center has hundreds and thousands of patient data. There is new patient data that the clinicians are entering, followed by recommendation that is available through literature, through articles, through books, and so on. The CDS, with the help of algorithms, and AI, there are neural networks, and there's a lot going on inside here, is able to give you information that will support in screening decision, in diagnostics, in surgical decision, and in medication decision. This is just an example of, a more intricate CDSS, that helps in hospital administration, that includes hospital admission, taking patients' history, ordering tests, diagnosing, the entire treatment and care flow, including discharge, so that's an entire hospital system that is integrated with CDS looks like. Again, slightly more intricate, this is, again, you have information on the patient's condition, you have literature available. It can keep getting more and more complicated is what I was trying to show you, and can support an entire population in their care. This is an example of, a slightly more intricate system where the CDS and the electronic record is actually communicating from one hospital to another, ensuring that, if a patient goes from one place to another, their data is available and there's adequate, output in their care process. Now, coming to, again, a very important piece that as doctors, we should be very careful about, and that's benefits and pitfalls, right? None of these new technology, whether it's AI, everybody's talking about it, everybody's using different tools, everybody's making a lot of different tools. But it's important that we are cautious in using these. We've seen the benefits that come from using a clinical decision support system that includes obviously improved patient outcome. I've given you a lot of examples of that. Obviously, enhanced decision making. It's helped standardize the clinical care process, reduces medication error. One of the very common uses is able to give personalized care to patients based on a lot of information that is available for that particular patient or the category of patients and so on. And a lot of data that we can analyze, and be able to conduct much better research. But these don't come without pitfalls. And as doctors, as clinicians, it's very important that we're careful, in using. All of these systems will mature with time. They'll get better. The accuracy will get better. The features and, how user-friendly they are will also get better. But, this is a changing environment. A lot of these are new. It's very important that while we're using them, we're careful. They tend to make errors and we need to be cautious. The reason why we have doctors, overseeing all these systems and signing off this before going to a patient is because they're not without errors. And as doctors, it's important that we are careful in using all these systems. One of the common problems that I see in hospitals is what we call the alert fatigue, Unfortunately, with so many systems in place, doctors get bombarded with so many notifications. And every notification that a doctor does not act upon is a notification that should not have come to the doctor, and that's the general rule. So, over the years, these features would get better, but right now, of course, this is one of the pitfalls of, all the tools and technology that exist in clinics and hospitals and just on your mobile phone. Lack of user training, again, very often, in hospitals, we see that these, tools get implemented without adequate training of the staff, without giving an opportunity to doctors to upskill themselves, acquaint themselves. You're already busy in your day-to-day work, and then, a new system comes in and, you're expected to use it the next day. I think that's not the best way to implement these in any clinical setting. We should also be careful about the privacy and security concerns. See, I'm not just talking about systems that are there in hospitals. You may be using a lot of CDS systems or electronic record systems, etc., in your own clinics for your own, patients. Very important to understand, is this data secure? Is there consent taken? Or, what happens if there's a data breach? Who's going to be responsible? And so on. These are new things that as doctors, we need to be very careful about. I've already spoken about incorrect treatment and diagnosis. These systems are not without fallacies, and that is why they always need a clinical oversight. They will get better with time. They will make less errors in years to come. But, this is a new system. The system's also learning, and as doctors, it's important that we are cautious while using these, never try to sign off anything without reading, do not trust the system blindly, not just yet. And this obviously happens a lot of times because of inaccurate data that we've entered, or just, the way there's a lot of poor data that is also available. One of the standard, rules of AI is garbage in, is garbage out. So if the data that's going in is poor, the outcome will also be poor. And lastly, integration challenges that a lot of you would have faced, if you're using multiple different softwares, and they're not speaking to each other, you don't have all your patient data in one place. And obviously, no one system is looking at the patient as a whole. And obviously, the care outcome isn't, absolutely optimal. So I'm going to take you through, what's happening in India. I took you through what, some of the use cases in the UK, but there's a lot of work that's happening within the country as well. There are so many different companies that are working on building AI models for doctors and other clinical care providers for better patient care. These are just some of the news articles that I've put together. They are all very recent, just around this year or last year. So here's an example of PD Hinduja Hospital that is using CDSS since the pandemic and continues to use that even today very well. Similarly, various hospitals have started integrating CDSS, clinical decision support system, into their systems to have knowledge available at the fingertips for doctors. CDSS would be a great support, especially for junior doctors, or doctors with, lower experience in certain areas. You don't see all kinds of cases all the time, right? So the evidence-based software will support doctors in making right clinical decision. Apollo, for instance, is another well-known hospital chain that's using AI-based clinical decision support in treatment of diseases. It's another example. Apart from helping arrive at a clinical diagnosis or support in treatment, doctors find CDSS very useful in helping them upskill and learn from these systems as well. Now, here's an example of some of the CDS systems available in India. This is just a list. These aren't all of them. There are many, many more, but I've just put together some of them. Some of these names you may have heard of, some of these may be new, but it's just interesting to know the amount of work and the areas that are being focused in India. So we have the Arogya app that's developed by CDAC, government agency. Arogya offers primary care decision support with modules for various conditions, and that includes pregnancy and child health. eSushrut, an open source CDSS by National Informatics Center. eSushrut primarily focuses on maternal and child health in the rural areas. MediConnect, for instance, is a cloud-based electronic health record platform with integrated CDSS features such as drug reminders, diagnostic suggestions, and order sets. CGM Health, again another example, provides AI-powered CDSS tools for various specialties, including oncology, cardiology, and neurology. Some more examples, you may have heard Fractal Ray, for instance. It's a mobile app and a web app that offers appointment booking and online consultation and has an inbuilt CDSS for to assist doctors. DocsApp is, another well-known telemedicine platform with AI-powered symptom checker and triage guidance, assisting doctors in their decision-making. Fortis has its own CDSS that focuses on specific specialty areas within the chain, like cardiology and gastroenterology and so on. Apollo has its own telehealth platform with integrated CDSS modules for primary care and chronic disease management. Healthify Me is another example. I've personally used this this gives you personalized health coaching and a CDSS tool for weight management and chronic conditions. Doc on Call is another one that I've used, is an AI-powered symptom analysis and personalized treatment recommendation tool. Jan Aushadhi is a government initiative offering CDSS support for pharmacists in dispensing generic medicines. Nirma is another one that I've worked with briefly. This is an AI-based cancer screening technology, very interesting device that's integrated with CDSS for risk assessment and personalized management plans. Critical, this is an AI-powered platform for early detection of critical illness and sepsis, providing timely alert and decision support to healthcare professionals. Jeev Diagnostics, again, offers AI-powered diagnostic tool for various conditions like cervical cancer, diabetic retinopathy, and obviously is integrated with a CDSS feature. HealthStart, this offers a digital health platform with CDSS tool for personalized healthcare, including chronic disease management and medication adherence. And you may have heard of Portia, again, a home health provider for remote patient monitoring and management and care coordination. And lastly, some other names, HealthPlex is an electronic health record, which a lot of doctors are using at a personal capacity. I've seen within their clinics. It comes with an inbuilt CDSS module for medication safety, order verification, and clinical guideline adherence. MFine is again another telemedicine platform in India that's AI-powered triage and a CDSS tool for primary care and chronic care disease management. Librate is another example. I think I've used this as well briefly, featuring a basic CDSS tool for symptom analysis and referral suggestions. Doc Planner is an appointment booking platform, for instance, that's integrated with CDS, for basic symptom analysis, triage, and guidance. So this is just an example. These are just examples. There are many more. There are many companies working, and there's a lot of interesting tools available. Don't be afraid of using them. I think it's very important that doctors learn to use these new tools. They are here to stay. They will only get better with time. Here's an example of just a short list of some of the tools that are available globally. So for instance, we've got Epic Care, Cerner, Athena Health, Walter Kluwer, UpToDate, Dynamed, IBM, GE, Philips. You name all the big folks, right? Everybody's working on, AI-based support systems for doctors. And, there's a lot of research that's going on, into ensuring that we've got the best, product available for doctors, and obviously, that would give the best patient outcome. So as doctors, one of the most important things is that we brace ourselves for the change that is coming. There is going to be a lot of use of technology in our day-to-day work. It's only there to support us. It would also be a minor irritant factor because the technology is also improving, and we are also learning, and the environment is ever changing. But it's important that we we try out these different systems. We learn how to use them. We leverage technology where needed. We constantly upskill ourselves. You see, none of these systems. I don't know if some of us may have heard in discussions, etc., that okay, AI is going to replace jobs and so on. It may replace some jobs. Every time there's new technology and there's change in the world, some jobs do get replaced. But that's not the case for doctors, right? As doctors, the amount of human skills, the amount of knowledge, the amount of empathy, the amount of analysis that doctors do is not something that will ever get replaced. I think what would get replaced over the next 20 years is doctors who may who do not leverage and cannot use technology will be replaced by doctors who can, right? That would be definitely some change. And it's important that as doctors we are able to leverage these. We are careful, of course, because it's a transition. It's a process. There's a learning process. These systems are a lot of them are still in their nascent phase. So be careful, but of course ensure that we ensure that we are able to leverage technology. We learn from them. Thank you so much. Happy to take any questions, if there are.
Thank you, ma'am. Thank you so much for your wonderful presentation. So, ma'am, we do have some question if you like to take that up.
Absolutely.
Yeah. So, ma'am, the first question from our audience is just a moment. Yeah. What kind of warning appears in CDSS?
Okay, so a clinical decision support system has different types of warnings. So here were some examples. Now, it depends on the area that the CDS is built for. For instance, if and a CDS may So a CDS may be built for one particular use case. For instance, it's built in to reduce medication errors. Then there'll be an alert. For instance, you're feeding in a medication that is contraindicated for the patient because of renal dysfunction. For instance, you have a patient with renal dysfunction, and you've put in a certain medicine and a certain dose. It will give you an alert. There'll be a pop-up saying, hey, your patient's got a renal dysfunction, this dose seems higher, or this medicine is contraindicated, do you want to still continue? Right. So the decision will always be with the doctors. You know best, but the system will support you in giving you that alert. For instance, there are drug interaction. If the patient's taking a certain drug, already, because you have that information on their prescription, and you enter another drug, the system will give you an alert. Hey, the patient is on this drug, and my knowledge says that it interacts. It reduces the efficacy, or causes toxicity if used with the drug you're prescribing. Do you still want to continue? So these are the kind of alerts, right? There'll always be a pop-up alert when you're taking the action, so that it doesn't go forward, and gives you an option to make that conscious decision that yes, I'm aware of it, I can still go ahead, or great, thank you for letting me know, I'll try an alternate drug. So that's the way CDS, example of how CDS supports doctors.
Thank you, ma'am. Yeah. So, ma'am, the next question from audience is, what are the reason for physician not adopting clinical decision support system?
There are various reasons. I know a lot of clinicians have adopted it. It supports them, gives them. There are lots of different types of people, right? There are early adopters to technology, people who are open to trying out new things, and then there are people who are more skeptical, right? So you'll always see some people, willing to try new things. They're willing to take that risk and so on. And some, there'll be some clinicians, or just some people, who would wait it out, right? So, and that's fine. There's nothing right or wrong. They're just different types of people. Now, having said that, why do some clinicians not use CDSS, or are apprehensive about using it? Is because, as I mentioned, it has its pitfalls. It comes with fallacies. It's important that you are you are aware, right? There are chances where it will give you a wrong recommendation. If it is building it, CDSS, for instance, can help build an entire prescription. You fill in the information. Okay, this is the patient, this is the age, these are the symptoms, this is the past history, medication history, etc. of the patient, and it'll come up with a diagnosis, and it'll generate an entire prescription. CDS systems that are immature, that are used with poor data, will constantly give you a lot of wrong, prescription or wrong information. And if you're subjected to, wrong, if, let's say, the percentage of inaccuracies are very high, then obviously clinicians will not, believe the system. Will obviously, it is, adding to the burden, for a cognitive load to the clinician, increasing the workload, etc. Right? So systems that are not mature, systems that are not good, if the systems that throw a lot of error, if these kind of systems are around, and your experience has been using such systems, obviously a clinician would prefer not using it, and that's why I said, let's work on, let's be aware that these are the systems available. Try it out, but be careful. They some of them are really good, but some of them do tend to throw, even the best ones can throw errors from time to time. There's a reason why there's no way that these systems can directly send any treatment outcome, or any suggestion or any advice to a patient without a clinician's oversight, right? So yeah, there are systems that have very high level of accuracy. They could be as high as 99.9%. That's how high we've seen in some systems, especially the simpler ones, like medication error related, blood transfusion, right? These are automated processes. But when it comes to diagnosis, treatment plans, etc., I think those are slightly more intricate areas, and more caution is needed from clinicians. So just to summarize, the fact that these are, still evolving processes, it's understandable. Some clinicians choose to keep away from it, and you will definitely see some clinicians using it as well.
Thank you, ma'am. The next question is, what are the risks of clinical decision support system?
Similar to what I mentioned, so there are a lot of risks of these systems. I think one of the bigger risk is error in diagnosing or treating, and the another risk is we being over relying on these systems. I think that's also another thing, because they don't come with policies. So it's important that you use them for your support, but have a critical eye on what is the outcome it is giving you. It may give you 10 correct outcomes, but that does not mean you miss the 11th one, right? So these are things that we need to be careful about. There are a couple of other risks, associated with the clinical decision support system. One of them is the way data is available, right? Medical data, healthcare data, it's very unstructured. It's not very easy to use. So while a lot of other industries have done well, especially the finance industry and so on, because data is definitely more structured over there in healthcare, patient medical records, etc. They're not as developed. So and that's why building these systems haven't been very easy. And like I said, garbage in is garbage out. If you're putting in poor data, then you're going to get a poor outcome. So that's something one needs to be careful about. Another risk that I mentioned is an alert fatigue. If any system is giving you too many notifications, I think that's a very poorly built system. These systems should give the clinician the most important notification. Every notification should be actionable. The moment I choose not to action a notification, that notification should not have come to me. That would just wasting my time, effort of opening, etc. I've seen clinicians sitting with systems which has 50, 100 unopened notifications. That's a horrible system. That's not the clinician's fault. That's a really poorly built system. So that's another risk. Another risk is, the use of artificial intelligence. Now, what happens when you're using artificial intelligence in clinical decision support is that there's data being entered. Now, you don't know if the data is correct. That's one area of risk. The second is, there's an entire system that is doing all the calculation, the algorithm, as you say, there are neural networks built in that's doing all the calculation and it's giving the output. Now, this whole thing that's doing the calculation is like a black box. You don't know what's going on, right? What if somebody's made an error in that, right? Then there's a possibility that the outcome is also wrong. So that's another risk, right? We call it explainability. There's lack of explainability on how the system arrived at a decision. So there's a lot of work now going on, especially in the EU. There's a recent AI Act that was published last year. And one of the important things that were mentioned was that AI systems need to be more explainable. What's the context in healthcare? As in healthcare, for instance, if it is giving you a prescription or if it is giving you an advice, I should be able to understand what calculation it did, what were the few things that it put together to be able to give me that advice. I would trust the system more if that is available. So these are some things still in discussion, and in the future, this level of information, etc., will be available. The doctors will be able to trust the system more. But again, this is, like I said, this is at an early stage. One more risk of AI based CDSS is bias, right? There's bias in the world, and we need to be careful, especially when AI is in play. There's bias around certain communities and so on, and that kind of bias comes into the system when it's giving an output. For instance, very surprising, but there was an instance where the system predicted that people from certain community are in need of less care than the other, and that's a system because there was a bias in the world. So as doctors, it's very important that we're careful of these pitfalls that AI or CDSS can have. Yeah.
Thank you, ma'am. The last question from our audience is, what are the major components of the clinical decision support system?
So a major component of the clinical decision support system would be the data that's going in. Now, let's break down data. What is this data? There's already existing information, and that would be all your medical literature. So all your clinical books, right? The published books, because that's authentic literature, all of that, more than what you can read, right? Like your Harrison, Davidson, and so on. And, hundreds and thousands of medical book relevant to the particular a health condition, or the particular specialty, and so on. So you have your medical literature, you have your medical articles that are published, right, that are evidence-based literature available. For instance, not just any article, but especially those that have used a PRISMA protocol in publishing and so on. So that kind of literature, a lot of data that exists, right? For instance, let's take cholecystectomy, since cholecystitis, right? That was the example I took. So, you could have 50,000 cholecystitis cases, for instance, right? In a lifetime, a doctor would probably not see 50,000 cholecystitis cases, but 50,000 cholecystitis cases from the past, with the symptoms that people have come with the age group that they have come with the gender, with the areas that they have come with the past history, etc., and what was the treatment available, what was the outcome, etc. All of that information would be available. So that is one component, data. The next component is all the calculation, right? The system in itself, right? The way these networks assimilate this information, categorize it together, and are able to give an output to you. That would be the second piece. And the third piece would be the interface that the clinicians would be using, right? That how is that information given to the clinician at the right time and in a very user-friendly manner, right? So that's the piece that the clinician would use, right? And that would be the third component. So just to break it into three simple: there's data, there's the system that's doing the calculation, and then there's an interface that the clinician can use to take that information and take the support they need.
Thank you so much, ma'am, for answering all our questions. Before concluding today's session, any last remarks from you?
Thank you everybody for joining in. I hope you liked the session. And if there are any specific topics that you would like me to talk about, I'll be very happy to pick them up, especially around AI or any new tools you want me to talk about. More into diagnostic or a treatment, or any other areas in healthcare. I'll be happy to take some more sessions around this. Very happy to know if there are any specific areas that you would like me to talk about. And yeah, my last note is, as doctors, it's important that there's a basic level of awareness amongst us on what is happening in terms of technology advancements around the world and in the country. We are aware, we are able to use these to our benefit, we're able to leverage them, and obviously let's also always be very careful, while using any new technology. Like I said, they'll all get better with time, but being careful is the right thing to do right now.
Thank you so much, ma'am, for joining us today. With your permission, I would like to conclude today's session. Thank you.
Thank you. Thanks a lot. Take care.